I was able to become an ER doctor. And I also recently went to law school and just finished that up as well. Now I achieved 3 degree programs, a bachelor's degree, an MD, a JD. Got the law degree to have another tool to help people and also to craft legislation. People have asked me what an ER doctor knows. And I think that's super interesting because we know a lot about things that go beyond medicine. So not only do we know how the whole healthcare system works and what needs to be fixed and how to fix it, we also talk to people about their struggles, about their low wages, their difficult jobs, exploitation by employers. We also deal with the prioritization of profits over people. So I won't just be someone that's one vote or a voice. I will be someone that will be there leading, trying to get something done for our district because there's a lot of potential in this district. We just need people that are willing to fight for us. But I also have a lot of experience practicing medicine in different ERs in different areas of the country. I've also done telemedicine. I've done some mental health care. I've also reviewed some cases for insurance companies, so I know how that works and I know why that's an issue. So I have those experiences. I also have the experiences, like I said, of hearing people's struggles and learning how bad things are in terms of low wages and things like that. And plus, I came from a low-income family, so I know the struggles that people face and what they need in order to have a good life, in order to have opportunities. And like I said, I also have the law degree, and that's really going to help me in crafting legislation and writing bills that can withstand a Supreme Court challenge. So one thing that has come up is how important it is to build a really good public transportation system. So if we could get money to fund a strong public transportation that includes some rail, I think that would really take us to the next level. I think that would bring a lot of investment into the community. It would bring more diverse industries. It also would keep more people in the district. And I think also educational institutions would want to invest more in this area. Maybe we would bring other educational institutions. Maybe we start to get some PhD programs that currently don't exist here. Those are the kinds of things that public transportation could elevate. We also need to improve healthcare drastically. I believe that we need to form the foundation to get to Medicare for all. But there's so much wrong that we need to fix first. I do think that we should let people buy into Medicare for either a no-cost amount or a low-cost plan. And we need to work on getting more doctors, more hospitals, more ER beds, more clinics. Specifically in Hidalgo, we need a county hospital. People have also talked to me about the fact that we need a VA hospital, and I totally understand that that's also something we need. But I think we would need a county hospital first, and then after that, once we can get that in place, a VA hospital. And I don't think it's ever been as crucial as it's been now. The Trump administration has really created a lot of chaos, a lot of damage. And we really need to win the Democratic House majority and hopefully the Senate majority as well to try to curb Donald Trump because he's going to continue creating damage in this country. I'm a fighter. I've fought my whole life. I fought from being a low-income kid to being a person who graduated from both medical school and law school. And I fight for my patients. I know how to fight in general, and I know how to fight for people. And that's what we need at this moment. We don't need someone who is complacent or thinks that they're just one vote or a voice. We need someone who's ready to fight and amplify that voice and write legislation for us.